So we're here at Ainsworth with Tony Pinkus, who is a legend in homeopathy. If you don't know about him, you've got to come to Ainsworth in New Cavendish Street in London. And we're going to talk to him a little bit about homeopathy and why we use it in dentistry. So thank you, Tony, for inviting me to this amazing den of vials and bottles and how I imagine old pharmacies used to be as well.
It's Tony's toy shop. Yeah.
Yes. How long have you been here for?
Well, I've been here for 43 years, which is a bit scary. And I mean, I started off as a pharmacist, and I very quickly ran out of road with what the remedies the drugs were able to do, because I was passing out drugs to people who were coming back week after week, and it was
not getting better.
You know, people who were on dozens of medications, and one medication to cope with the side effects of them than another one.
Yeah, I know.
You started to ask some questions of whether these people were actually getting cured. Yeah. Obviously, conventional medicine has a big place, but if you only look at it in a confined box as the only thing available, then it's very limited. Yeah. And we all know that antibiotics are running out of a road. Yeah. And there isn't a mindset that says, rather than develop a new way of using a new mechanism of antibiotic use, whether or not we can stimulate the physical body to come back with a healing response. It's a very much more refined and, if dare I say, sophisticated way of using medicine, because instead of introducing a drug that's going to do something in your body and then afterwards somehow you will magically get better and you'll recover. So what we say is, why don't we tweak them? What we're doing with homeopathy is just giving them a nudge so that they continue along the same path and improve to that level.
Can we ask you about arnica? Because most people know, when you ask about homeopathy, that's the first thing they know. They know arnica cream, if they bruise themselves something, and they know the little tablets as well. Right. Yeah. So can you explain a little bit about how arnica works?
Arnica is an intriguing one. It's like a Swiss alpine plant, and for centuries people have seen sheep falling over on skiing sheep falling on mountain sides, and if they injure themselves, they go and chew arnica. Yeah. Arnica was given out in the First World War to the soldiers as a remedy for trauma. It's a hemostatic, so it's very rapidly will stop hemorrhaging. It's very useful for bruising. You shouldn't put it on an open wound because it will aggravate the tissues. But apart from that, it's extremely valuable in overcoming the side effects of, I say, operations, dental operations, and ideally taken as part of the recovery process.
So we've been using arnica for dentistry for about 10 years, and I've been using it for every single extraction, and it's wonderful and works really well. But then since getting to know you better, we've tweaked it, and now we're using your surgery mix, which is like arnica in second level. It's really good for bruising and nerve pain afterwards, and we're finding that when we take teeth out and we're giving them that, we're finding it's a massive difference on post-op recovery. People are feeling better and not having to take painkillers, which is brilliant for us.
So we can tweak that, you see. So we start off with the arnica, but then we put in other remedies like calendula to enhance the healing, hypericum for the nerve pain because you've got nerve injury there, and then we've also got other remedies like Staphylococcus aureus, which is to speed up the resolution of the laceration. If there's any laceration in the mouth, the tissues of the mouth, and that will speed that up. And it's also, ironically, beyond, because we're not limited to the physical dynamic there. The mental associations of the remedies like arnica are don't touch me. Don't touch me. And the one with Staphylococcus aureus is, I feel cut up. They feel physically cut up. So, and then we have Bellis perennis, which is supplementing the action of the arnica after the bruising. It helps the blood the extravasated blood to be reabsorbed, and it helps the soreness and the swelling of the tissue. So we use this in dentistry is fantastic, but we use it in major surgery, and most surgeons turn around and say, "Well, what have you been doing?" They can't understand patient is suddenly recovering about a month faster than they thought they would.
For us, it's getting people in the right state before we do the treatment first. So get them anti-inflammatory and get the diet right and the rest of it. And then doing as minimal trauma as we possibly can when we're doing the procedure. But then also giving their body a chance to heal. This works brilliantly for us.
We can flex it slightly because we can use different strengths, and we can, have a higher strength for the more acute side. And then we would consider, bespoke, if you like, to the patient if necessary. But this is as a sort of a generic remedy for any operatives, post-operative.
Brilliant for us. And we've also been using hyperculum for nerve pain. So we've been, when we've got teeth that have got very deep cavities, or we're worried and we're trying to avoid a root canal, and we want the body to heal, we've been using the hyperculum one, which I think you made up for us as well.
Hypericum, hypericum is brilliant, and there is hypericum in the surgery, but the hypericum is St. John's wort. Now, St. John's wort is got a variably good and bad name, principally for crushed and injured nerves. So, just to give you an interesting example, we had somebody who came in who'd had an amputation because of, the limb had to be amputated, their arm had to, but this lady still had phantom limb pain all the way down to her fingertips. And I said, okay, well, we'll give you some hypericum, and the lower potencies took away the pain in the hand, and then the very high potencies took the pain all the way up to the
Brilliant, amazing. And the other thing we use a lot of is your rescue remedy, because you have your Ainsworths rescue remedy, which we use when patients come in to see us. First of all, they can be quite nervous and they're sitting in the waiting area, and then my team can notice that and say, "Would you like a little spray of this?" And it really, you see them just sort of easing in. So when they come and see me, they're much sort of in a more parasympathetic state before we do any treatment or anything, so that they listen better. So that's what we're using.
So we actually changed we've actually changed the packaging at the moment. But so this remedy here, the small bottle, that's the original rescue remedy formula, and batch collated 5 remedies, which are all to do with the shock, the discombobulation, the fear, and the pain, and he put those together. Over time, people have extrapolated the use of this to all sorts of fear. But it doesn't contain the fear remedies. So what we did was we made this mixture, which is like a recovery plus, which contains 3 additional remedies for fear. Either for your mind going 10 to the dozen and then you can't get those worrying thoughts out, or fears that are either known or unknown. And then we made it into, that's because traditionally these are made with a brandy base. And you need to put them into water before. All of the remedies are working by flooding the water of your body, and that the sort of the vibration that goes through that translates through the water and then is active. That sounds pretty cookie, but we're actually doing some cutting edge research to show you that even if you put the water in a vessel of water, or even a lake, you can find the track of that remedy in that lake or in that body of water. What we've done here is to make a non-alcoholic version. So this is safe for everybody, anybody who has any religious reasons for not taking
And we've been using that a lot with children as well.
This
really want to give them brandy in the morning.
This is great because it's just, you carry it around, it's a spray, you can just, quickly put a spray on your tongue. It doesn't taste of anything.
Well, thank you very much for spending time. This is an Aladdin of caves. So if you want to come in London and want to see Ainsworth, or come to London and see us at Optimal Dental Health, we will show you how we're incorporating all of this to help you heal better, less pain, less inflammation, and less disease.
Brilliant. Wonderful. Thanks for coming in.